for each of you to talk about what you're ornery about. What is it that you feel
Well,
we
yeah, Larry.
want to do better?
Bertha, you answered a very important question, because when my colleagues turn around and say, Larry, why are you so ornery today? I'm going to say it's because we're in healthcare. As we look at our healthcare system today, obviously it has challenges. Many people say the system's broken. We would sit here and say, our healthcare system was created for episodic care in a fee-for-service environment, not one that is created to support and provide for the individual healthcare needs of consumers. And healthcare has grown to almost $3.6 trillion. It's 18% of GDP. It's continuing to grow. We know more than half of all Americans suffer from one or more chronic diseases, and the dollars that we're spending on that are not helping those individuals to achieve their best health. And I can go on and on.
I often say to people, no one in their right mind would ever design a system like the U.S. health system in the way it has evolved, because it just is not efficient, and in a sense, it works in opposition to doing what you're trying to do at Kaiser and what you're trying to do with the merger with Aetna.
And picking up on what Larry is saying, I think that we have to come to the reality that in the 21st century, a sick care model is not the right answer.
And I think the challenge that we have today is, as you look at healthcare, it's a series of transactions, and who's connecting the dots across those transactions versus the opportunity that we have to provide care management, to patients, consumers, individuals. Those words are all starting to get blurred now, and I think that's the direction that we need to go. We need to take healthcare to where the people are, to the communities in which they live and work, and it's the opposite today.
How do we design a health system that focuses on prevention as the best medicine, which speaks to self-care, and then early detection, early diagnosis, early treatment? How do we deal with a system of coordination of care and services that deals with what you just described, chronic care, and doing it in a way that is not episodic? And so that's, I think, the both exciting and daunting challenge that we have in front of us.